Good day, everyone, and you're welcome to today's ODIN webinar, which is focused on utilizing environmental surveillance to advance public health action in Africa. So we are going to be sharing the story of the ODIN wastewater surveillance project. This is the first in two series webinar that we will be uh, undertaking for the ODIN project. So this first ODIN webinar is focused on sharing our process with you, with the scientific community, with all our stakeholders to show you what we've been doing and how we set up environmental surveillance system in Africa. And now we are carrying out capacity building and working on the sustainability of this project. You're welcome wherever you're joining from. So please, you can, while we are taking a minute to wait for everyone to join, you can just introduce yourself in the chat. If you can quickly just type your name and tell us where you are joining from in the chat, that would be really good. So my name is Paul Kimpriest, and I'm a research project coordinator with the Global Health Network here in Oxford, and I'm the scientific lead for Work Package 7 of the ODIN project, which is focused on dissemination. So I'll be chairing this webinar today, and I hope that we all have a wonderful time here. So please type your name in the chat and let us know where you're joining us from. Okay. So we can just take a minute to just wait for anyone with who might be having technical difficulty. I can see someone from Congo, Brazzaville, Kenya, Canada. I can see people from different parts of the world. So that's really good. India, Finland, Pakistan. Excellent, excellent. You're all welcome. All right. So without wasting much time, I think I'm going to take us through a bit of housekeeping before we start at the webinar proper. So this webinar is being recorded and it will be shared on the Global Health Network platform. And the link for where this is going to be shared will be dropped in the chat, so just so that you can keep an eye out for that. Now you can also turn on closed captioning for subtitle in any language that you prefer. So down on your Zoom, if you see show caption, you can um, put that on to get subtitle in any language that you want as well. Now, so due to the number of participants, we are going to turn off your videos and your microphone. But if you have any question in the meantime, you can put it in the Q&A function, and then you can also use the chat function to introduce yourself or report any technical issue that you might be having. You may also want to ask, if you want to ask a question anonymously, I think that can also be done. So this webinar is going to run in, okay, just to give you an update of where people are joining us from. So this is the map showing where people register from, I think, from different parts of the world, Africa, largely Europe, North America as well. So these are the panel of people that are going to be talking to us today from their experience. These are seasoned professional and faculty members from different academic institutions and the researchers who have been working on the ODIN project. So they'll be sharing their experience on setting up this wastewater surveillance project with us today. So we are going to run this webinar in two sprints. So the first three presentations, and then after that, questions. Then we also have 3 to 4 more presentation, and at the ending, we'll have some time for question. So if you have any question, so please just hold it for a bit, and then we'll take the questions just after the first 3 presentation, and then after the last 4 as well. So without wasting much time, I think we're going to go ahead and start with the first speaker. So our first speaker is our Professor Rolf Lud, who is a professor of infectious disease at the Lund University in Sweden. So he is the coordinator of the ODIN consortium, and he will be starting us off by sharing with us the innovation and the innovation of the ODIN consortium itself. So, Rolf, you're welcome to share your screen. Thank you.
Thank you so much, Paul. Let's just see. Let me just share my screen here with you all. Here we go. Thank you, and thank you to the organizers as well at the Global Health Network for setting this stage. My name is Rolf Lud, and it's been my privilege to serve as the coordinator of the ODIN and ODIN MPOX consortia, which you will hear much, much more about today. And today I want to take you on a quick journey, how ODIN started, what drives us, and how this partnership has grown into something much larger than a project. It has truly become a community, a shared commitment, and in many ways, a long-term investment in health security. So I will try and give you all a high-level summary of this project, or these projects rather, after which some of my colleagues will dive deeper into selected aspects of the program. So what is ODIN? I could spend an hour talking just about that, and don't you worry, I will not. But at its core, I would say ODIN is a partnership with purpose. So it's an international consortium of European and African researchers built around one central idea. And that idea being that genomic surveillance should not be a privilege reserved for certain countries. It should be accessible, actionable, and deeply rooted in local context. So we are trying to bring together public health institutes, academic researchers, government employees, and different stakeholders within this area to try and address the need for rapid detection, analysis, and response to emerging and re-emerging pathogens. So we don't necessarily see ODIN as a project, because a project has a beginning and an end. This is more a vision, if you so wish, of a better world. And for us to reach that, we have to not only consider, but we need to emphasize sustainability, a local ownership, and of course, a timely response. The conceptualization of ODIN, it didn't start in a meeting room as such. It started through conversations, in real life experiences, in field sites during outbreaks, in hospitals where you could see the devastating power of pathogen outbreaks. So it all started because we wanted to make a change. We wanted to, albeit realizing that our impact may be tiny, but we wanted to make the world a better place. So this was not only about science, it was more a calling, if you so wish. And we heard repeatedly the same challenges being mentioned. Limited access to equipment, delays in procurement, lack of harmonized workflows, fragmented genomic surveillances, limited capacity, lack of training, and just a pressing need for stronger regional coordination. And the important thing here to stress is these were not abstract problems. They were lived experiences of partners who knew exactly what was needed. And ODIN, we believe, was built to respond to these realities. So it's a product of listening before designing. So the vision may be a bit ambitious. It's simple though, but ambitious. We want to build a network of capable connected laboratories across sub-Saharan Africa that autonomously can detect emerging pathogens. They can analyze data and respond in real time. Our mission then is, of course, to build that infrastructure and expertise needed to make that vision real, not through short-term deployments, but again, stressing the sustainable, the country-led capacity building that is needed to make this last. So we want to help create a landscape where every partner can take surveillance into their own hands with confidence and continuity. One of the things I appreciate most about ODIN is the diversity and dedication of the people involved. So we have organizations from Sweden, Norway, Finland, Belgium, UK, Tanzania, Democratic Republic of Congo, Burkina Faso, all being directly involved in this project. And of course, we have many, many more people involved in the project as such, representing Health Institute, Public Health Lab across Sub-Saharan Africa, academic and research partners with expertise within genomics, epidemiology, translational research, infection medicine, clinical research, data management, bioinformatics, and much, much, much more. Each partner bringing their own different strengths. But what I would say is what really stands out, as far as my experience goes, is the spirit of collaboration. People genuinely want to contribute to something bigger than their own research area, than their own institution. And that shared motivation is what really gives ODIN the momentum that we're seeing. To achieve our goals, ODIN operates through several core components. We have mobile laboratories for on-site sequencing, and we will hear much, much more about these core components here later in the talk. We do a lot of training and capacity building in laboratory workflows and data analysis, standardized protocols. We have integrated bioinformatics pipelines, data sharing frameworks, and of course, not the least, local leadership. So this is what we try and facilitate to have all of our partners having hands-on access to equipment, being able to run protocols end to end, seeing their own samples produce interpretable genomic data. And this is why our strategy is hands-on and collaborative. And after my talk, as I mentioned, you will see and hear much, much more about these core components of the project. But the innovation of ODIN is not only about the technology we deploy, even though, of course, we are proud of the mobile labs, the bioinformatic pipelines, etc. But I would say the real innovation is in how we work. We focus on training the trainers so that the knowledge can stay local. We try and build systems that work reliably, even when the logistics may not really be as good. And we try and create tools that don't require a specialist to operate it. So we want everyone to be able to perform their surveillance work independently, regardless of where they are, if it's in a city or if it's somewhere else, if it's in a rich country or in a developing country, whether you have an academic background or not. And that, I think, is a true innovation of ODIN, that everyone should be able to do this. When it comes to coordination, as a coordinator, this has been a very pleasant journey, I would say, due to the team spirit of everyone and the overall organization. So we have a structure based on a central coordination team, which is basically represented by PIs from all of the involved countries. And then we have national leads and different thematic work groups. And this has really facilitated the work because we can focus on what we need to know. We can focus on how we communicate within these different segments. And it gives us the right amount of details in the right forum. But beyond these kind of infrastructure settings, coordination is even more so about trust, about building relationships, troubleshooting together, and making sure every partner feels supported. And that's really my job in this consortium, not to be the one with the most technical knowledge, but to make sure everyone feels supported and that we all move in the right direction. On that note, we are part of a bigger network called GENEPI, where we have many other EDCTP3 funded and Gates funded projects as well. I will not go through, mention them all here, but I do encourage you all to go into the link I mentioned here below and to get a closer look at our project as well as the other ongoing projects within this field of genomic epidemiology. And together we try and really make an impact. I will not really give away too much of the ODIN MPOX work we have ongoing right now, because that will be presented here in just a minute. Other than mentioning it, I think this is one of the prime examples really of how we have been able to position the ODIN platform within this context and how we can contribute and make a real difference. With that being said, I wish to thank you very much for your attention. And I hope by now it's clear that ODIN is a global platform, and we welcome everyone to join our endeavor. I'm happy to connect with anyone interested in learning more or collaborating. Feel free to reach out. And with that being said, I'm happy to hand over to my colleague that will let you all know more about our Mpox specific projects. Thank you.
Superb. Thank you very much, Rob, for explaining the ODIN vision so clearly. So if you have any question for Rob, don't lose it. Please just keep it because you'll be able to ask your question in a bit. Moving on, we'll be moving to our colleague in DRC, and then Dr. Ivodi Ingelesi, who is a physician, as well as a regional coordinator with the uh, University of Kinshasa Department of Tropical Medicine. So she will be explaining how ODIN Consortium is doing in DRC and how we're integrating Mpox into the surveillance. So over to you, Ivodi.
Thank you, Paul. Can you see me?
Yes, we can see you.
Can you see my video? Yes. Thank you. Hi, everyone. As Paul said, both University of Kinshasa and PGA Shen for ODIN as the regional coordinator. I will take 10 minutes to explain how ODIN starts to how ODIN Mpox started. First of all, ODIN started, as Dr. Wolf said, with a consortium working on bacterial surveillance, on environmental surveillance of bacteria. And then we moved to ODIN Mpox. And next slide, please. And to work with Mpox was an urgent need. We had this outbreak, which started when ODIN has 1 year working, and we have this re-emerging zoonotic disease, which is Mpox, with a particularly rapid spread and similarity with other clinical diseases, and we didn't have enough means to manage everything, and our sub-Saharan public health system are so vulnerable. So it was something very urgent to move from ODIN to ODIN Mpox using whatever ODIN started. So ODIN was the foundation on which ODIN Mpox started, because ODIN had already a very good consortium with network, expertise, leadership, coordination, everything. And ODIN has also had the whole administration process, excuse me, I'm using my phone, the logistic process, and it was very easy to move from ODIN to ODIN Mpox because some costs was very easy to manage and very reduced because ODIN were already working, ODIN was ongoing. And then from this, we are moving to that's what I called multifaceted approach of ODIN Mpox, which aim to goes behind traditional care surveillance, leveraging wastewater-based epidemiology instead of just cure people who presented clinical symptoms. ODIN want to go behind this, to implement the surveillance, to detect to detect Mpox in community, because ODIN Mpox work on wastewater. So this wastewater from open sewages is from community. So it's a mean for us to detect Mpox in community and to enable early intervention. Another phase of ODIN is environmental genomic surveillance and mobile staging units. We have to implement mobile lab to have access to hard to reach areas where we can just sample water and have analysis on site. The ambition and objective that ODIN need to reach to attend is to implement a comprehensive system. We know that genomic surveillance is something very robust, but we need to implement it as a very comprehensive system in DRC and neighboring countries. For the both sub-Saharan countries involved in this project, such as Tanzania and Burkina Faso, we aim to have samples from airport and other borders. Tanzania has already started. For DRC, implementation is ongoing, and we need to become after this project to write a guide of public health intervention, because to inform a vaccination campaign and resources allocated to high-risk area, to enhance detection and response, rapidly detect, if we can see disease in environmental before having outbreak, clinical outbreak, it's something very, very good and more easy to handle. To implement also a sustainable development model is just something will help sub-Saharan country, because to implement those kind of projects in sub-Saharan condition is something not easy. For the DRC, we had started with Kinshasa, and then we moved to Goma, and then the country was facing conflict. We go back to Kinshasa. It was something difficult, but with this experience, we aim to learn other consortium, other public health system, how they can develop a sustainable model. And we need to contribute to global health strategy by develop a variable data for global public health strategy and future outbreak preparedness, because, ODIN was working to face outbreaks. And just 1 year after the ODIN implementation, Mpox started. So ODIN Mpox is, I don't know how to say it in English. ODIN was growing, but also facing the Mpox outbreak. So what we expect is to integrate Mpox surveillance, Mpox environmental surveillance into public health systems, and improve sequencing and bioinformatic capacities. We also have too many trainings, as Dr. Wolf said, but we have also 4 MRC students in Kenya learning bioinformatics. And we need, after all this, reduce the burden of Mpox through effective intervention, such this environmental surveillance using wastewater will be effective intervention that public health system can implement. And we need to have the impact of development of adaptable mobile surveillance equipment, as I said earlier. And this action will contribute to the sustainable development goal and cost-effective method for limited illness and infection, which is something valuable for the economy. For the future, in one word, I can say that we need to move from reactive to proactive monitoring of infection. You can see on photo, the first one is a sampling on a child which is suspected to have Mpox. And the second is our team, DRC team in Goma, inspected sites where refugee camps, where wastewater, open sewage, drinking water are not well disposed. So instead of curing the people who has already clinical disease, we aim to implement a surveillance system which will help to to stop the disease spread before having a clinical outbreak, if I can explain like this. And finally, have sustainable solution and a significant contribution in combating mpox, enhancing public health security in DRC. And I think I can say thank you for your attention.
Superb. Thank you for your presentation, Dr. Ivodi. I think I have some questions, and I think people might also have questions for you, but we'll take them just after this next presentation. And particularly, it
Okay.
would be good to know how you're working in that kind of a difficult context, considering we know there have been some issues in DRC and over the last couple of months, and how you're working through all of that. So, the next presenter is Professor Taria Pikanen, who is leading the work package 2 of the ODIN project. She has over 20 years of experience in water, microbiology, and environmental health. And she's a seasoned person in this area with experience from different global contexts. And I think we are going to have a wonderful time listening to her presentation on how they're implementing sampling and in the ODIN project. So over to you, Taria.
Thank you, Paul, and thank you having me. So I hope you can see my slides and hear me well. So in this presentation, I will walk you through how we have approached the setting up of environmental surveillance systems for multiple human pathogens in 3 sub-Saharan African countries, Tanzania, Burkina Faso, and the DRC. The work has been divided with 2 different consortiums or work packages. So the ODIN work package 2 is led by Finnish Institute for Health and Welfare, THL, and the ODIN mpox work package 3 is led by University of Helsinki in Finland. And this presentation is prepared in collaboration with the project team members. So we are many of us who have participated on creating this static laboratory setup for environmental surveillance systems. So the beginning of our work has, of course, been the main aim that we have in our mind in the ODIN mpox consortium, so strengthening environmental surveillance to advance public health action. And our specific goal in these work packages was to set up these environmental surveillance teams specifically for priority pathogens in these 3 sub-Saharan African countries as a proof of concept for the region. So our approach has been static laboratories in local level. So they have been either the local research laboratories or national public health laboratories who have actually performed the work. So what we have our intention is to cover both non-sewerate and sewerate sampling, and then develop environmental microbiology analysis protocols. What we aim to do is to integrate this environmental surveillance with the genomic epidemiology, and this is a lot to deal with capacity building in both of these sectors, sampling from the environment, how to analyze the samples, and how to do the further genomic investigations for those isolates from those samples. We have done protocol development, and we want to have these protocols improved over the time, and also make them freely accessible to all. So we have bacterial targets, and we have selected selective culture media for colony counting, and those methods are followed by confirmation tests and whole genome sequencing of isolates. And then, as Evody explained you earlier, we have mpox as one priority target, and we have a multiplex quantitative PCR method and high throughput sequencing methods for this pathogen. So how we end up to our selection of priority pathogens, back then we decided to organize stakeholder workshops in all of these 3 countries. We have published in the International Journal of Hygiene and Environmental Health a peer-reviewed scientific paper explaining to you how the stakeholder workshops were organized and what kind of outcomes we gained from those workshops. So in this slide, you can see the QR code to this paper to read more about this way how to do the prioritization. I want to say that there are also other approaches for prioritization. Also, WHO has launched a draft protocol for prioritization in wastewater surveillance. So this is just the one way how to find out what are the priorities of the communities. So our selection for the priority pathogens has 3 different elements. So first of all, we were interested to include waterborne pathogens that are causing disease burden in sub-Saharan Africa. So we selected Salmonella typhi and toxicogenic Vibrio cholerae as our target pathogens. Then the second area of interest is the multi-drug resistant pathogens, and from there we are interested on ESBL and CPE pathogens, especially species Escherichia coli, E. coli, and Klebsiella pneumoniae. And then after the emerge of clade 1b, we also incorporated mpox as an outbreak response in our environmental sampling protocol, and we have emphasis to differentiate clade 1b from other mpox clades. And on top of that, it is very important to have a quality assurance of the samples collected. And for that, we are using fecal indicator bacteria, so normal commensal E. coli and intestinal enterococci colony count work as a proxy of fecal contamination in those samples that we are collecting. So after we have this prioritization and selection conducted, then we moved on to develop a protocol for environmental pathogen surveillance. So we created and published a proposal for cost-efficient environmental surveillance strategy. This was published in the December last year, so 12 months ago. So here is also a QR code for that publication. So there you can see the selection of target pathogens, selection of sampling sites and sampling frequency. So we have wastewater sampling locations, then we have surface water sampling locations that we know that they contain human excreta, and then we are also interested on drinking water safety. So we have drinking water samples and well water samples that we are analyzing in this ODIN consortium. And for those samples, then we piloted and had a training on the methodology how to take this environmental sample, and especially the logistics were something that we needed to work quite a bit in the beginning of the sampling campaign. In these pictures, you can see photographs from the sampling sites, and those are the sampling sites that our consortium partners in Tanzania, Burkina Faso, and DRC visited monthly to take samples for the analysis. So as said, these laboratory protocols, it is a core of our work in ODIN Work Package 2 and ODIN Mpox Work Package 3. So we have published ODIN Laboratory Handbook for the static laboratories, and also that you can read from the Global Health Network webpage, this project webpage. So in this handbook that is publicly available, we give a standard operating procedures for pre-treatment of environmental samples, for pathogen analytics, and also for the whole genome sequencing. On top of that, we have also prepared an amendment for this handbook that is specific for sampling and detection protocol for Mpox in static laboratories. At the moment, we have completed the ODIN sampling campaign. So our sampling campaign, it ran from January to September this year across the sampling sites in Tanzania, Burkina Faso, and the Democratic Republic of the Congo. And in Tanzania, we had 2 different cities covered, Dar es Salaam and Tanga. In Burkina Faso, we took samples with the local project teams from Ouagadougou and Nanoro, and at DRC, we finally ended up to take samples from Kinshasa. And you can see here the number of the sampling locations. So we have wastewater sampling locations, we have surface water sampling locations, and we have drinking water sampling locations. And during these 9 months of the ODIN sampling campaign, the local teams have processed already more than 300 samples from these sampling locations. And if you are interested to know more about this sampling campaign, there's also a QR code for the web news that we have released just recently that is also available from the project website. Some key outcomes and lessons learned throughout this work. So what we have already achieved is that we have been able to bring together the relevant stakeholders. We have shared understanding on the possibilities of this wastewater surveillance, environmental surveillance for public health action. The local laboratories, 4 of them, they have really deployed the ODIN laboratory handbook for these microbiological investigations, and the sequence library production has begun. And then we have produced environmental surveillance data from these 3 countries, and this serves as an example for the future work. So what we have learned is that the collaboration is the key. So we need to find right stakeholders and clearly defined roles. So for example, the polio surveillance activities already ongoing have been very important for us to be able to initiate the environmental sampling campaigns. We have also learned a lot about the timely communication with the decision makers to ensure that we really can make a public health action based on the findings, and there has been some really good examples already on that direction. So what we also have learned that this environmental laboratory protocol, it requires a lot of work and specialized training. And this ODIN handbook was useful, and it still can be improved on some parts. It was evident that we need to have operational flexibility because, for example, this addition of mpox as a priority target in the middle of the project, it caused some additional work, and overall, as we have 3 different countries here, this regional harmonization, it is something that we have really emphasized here, and this is something that we believe that this enhances early warning, supports the cross-border interpretation of disease and disease trends and AMR trends, and also strengthens the continental preparedness. So I would thank you for your attention.
Excellent. Thank you, Taria, for that succinct description of the sampling process for the ODIN project. I think it is now time for us to answer some questions. Okay. So some of the questions that I can see in the chat, I think might have already been answered. And thank you very much, Ro, for answering live some of those questions. Somebody's asking about how do you manage the environmental surveillance? Is it in water, in animal, or how? And I think these questions came before Taria's presentation. By now, you will have know how that is being done through the wastewater and also drinking water samples that has been taken. And then there's a question specifically for Ivo-D about how quick it was to adapt from ODIN to the ODIN mpox project. And I think the second that is similar to it is regarding sustainability, ownership, and oversight, and how, if there's a success story of any of these projects that has been transitioned to fully government-run and funded. So I would say, if we can say something on this now, otherwise, let's hold it because somebody's going to talk about sustainability and of the ODIN project itself. So, Ivo-D, do you want to respond to this question?
Yes, I will give something. For mpox, the experience of government founded it and everything, not yet. But for DRC and for many sub-Saharan countries, we are used to work on clinical cases, clinical outbreak, and to conduct a vaccination campaign. So, if I can call it a project, the government founded a vaccination campaign. We don't have a project that the government have founded for environmental surveillance or another surveillance for those kind of infectious disease. It's what we aim to reach with ODIN. We have too many meetings with stakeholders. In those stakeholders, we have the Public Health Ministry, Environmental Ministry, and the Public Water Society in DRC called Régie des Eaux. And we saw outcomes, lesson learned, difficulties that we are facing, so they can see what we are doing, what we need to reach, and we expect that it will finally become a government project founded by themselves.
Yeah. Yeah, thank you very much for answering that, Ivo-D. Yeah, so as it is, that is one of the things why we're emphasizing ODIN as a proof of concept, even for the government and that's why we're working with them to ensure that we show this as a proof of concept for something that can be picked up, because environmental surveillance is not generally part of routine surveillance across most of Saharan African countries. So the next question that I think I will want either Rolf or Taria, if you're able to answer, is regarding so Hamisu said ODIN has a good laboratory approach, but I don't see strong linkage with field surveillance for response. And I think you have something to say to that. Yeah.
Yeah, maybe should I say something on this? So thank you really much on this question, and I think that this is something indeed that we will process later on in the project, and there will be still presentations coming on these epidemiological linkages. Of course, this public health action is also something that we are not maybe able to showcase all the examples here in the webinar, but what we have seen that this local information sharing is the key, that the local stakeholders know the sampling locations that are sampled, and that also the results they are delivered at the local level for those who are the public health decision makers. And I believe that we can use quite a lot on this information that is available from the polio surveillance network, because this population coverage, for example, is estimated there. So I think there's still quite a lot to do, and it is not only for the African region. It is true for globally that this public health action of the wastewater surveillance it is still something that requires development. Thank you.
Excellent. Superb. Thank you for that. Rolf, do you want to say anything to it, or we can just proceed? Okay, thank you. So I think without wasting more time, we'll move to the next presentation. But before I move to that, I think I saw someone ask about internship opportunities and all that. You can please reach out to us. So if you go to the ODIN website, you can reach out to us or reach out to any of the PIs directly. Capacity building is a strong part of the ODIN project, and we'll see how we can support capacity in African countries particularly. Okay, so moving on to the next presentation, and any other question we'll be able to answer them at the end of this webinar. So the next presentation, our next presenter is Dr. Adriana Krolika, who is a senior researcher with the Norwegian Research Center. She brings in over 18 years of experience in, biodiversity, environmental DNA, and detection of animal and human pathogens. And so she is going to be talking about how ODIN is setting up mobile laboratory in these countries. So, Adriana, over to you.
Thank you. Thank you very much. Thank you for organizing this webinar. In my presentation, I will focus on 3 aspects: on how mobile laboratory setup in ODIN project can be considered as innovative, how we implement sustainability in our work within the ODIN project, and as well, I would like to say something about challenges that we faced during so far in those 2 projects. Next slide, please. To provide some background information, I'm presenting here this slide with original goals for mobile laboratory, as we defined in Work Package 2 and Work Package 3 in ODIN and ODIN Mpox projects respectively. So the main objective is to develop a mobile surveillance laboratory for molecular tracking of human pathogens in environmental samples, and the secondary objectives is to provide extensive laboratory training to researchers, to the students in molecular methods to be deployed by mobile surveillance lab. Subsequently, could you come back? The original objective were expanded to incorporate ODIN Mpox project objective. The expansion involved developing a surveillance method for detection using qPCR and characterization of mpox genomes for field application. Next slide, please. So the development of standard procedure was an important aspect of our work in the initial phase of the ODIN project, as they form the basis for reliable detection of human pathogens and antimicrobial resistance. Molecular structure for mobile app, we believe, can be more sustainable solution due to its adaptability, rapid deployment, and reduced environmental footprint, because there is no need to transport the samples to centralized laboratories. Module A integrates components for sampling, samples pre-treatment, nucleic acid extraction. Module B is dedicated for human pathogens detection via quantitative PCR, since quantitative PCR still is the gold standard for this kind of molecular-based detection. Module C integrates components for high-throughput sequencing, and here for Module C leaves the user as well 3 options to choose from the cheapest and the fastest to the most complicated, but that one allows as well detection of RNA viruses. This approach for mobile app that we have applied allows for efficient resources allocation, as models can be deployed only when and where are needed. Furthermore, the ability to quickly respond to reconfigure and upgrade individual modules expands the lifespan of the mobile laboratories. We have as well adopted a minimalist strategy, avoiding very complex, expensive, and energy-consuming equipment that is really challenging sometimes to maintain, and thereby reflecting a more sustainable approach. Finally, the potential integration of renewable energy is something that maybe in the future should be considered. For example, the use of the solar panels. In September 2025, we have successfully deployed our demonstration mobile laboratory in Dar es Salaam. This initiative, while a departure from our initial plan, proved invaluable for mutual capacity building and knowledge exchange. We gained critical insight into the logistical challenges, for instance, in terms of consumables acquisition in some of the African country, and the operational issue faced by the public stakeholders in managing infectious disease outbreaks. But we believe that sustainable impact beyond the project end requires continuous communication and deep understanding, as well understanding about the existing mobile laboratory infrastructure. The crucial support that we have received in Tanzania and the person that is responsible for mobile lab infrastructure in National Public Health Lab in Dar es Salaam exemplifies this need for this kind of good communication. Our visit yield as well tangible outcomes, including the generation of the 70 metagenomes and certification of 25 researchers from 4 countries, including Burkina Faso, DRC, Tanzania, and Ethiopia. The immediate analysis and visualization of the results were the most inspiring aspect, suggesting that the ODIN platform could be a vital tool for the public health stakeholders. The platform was on the previous slide. If you could kind of come back. Yes, it's an example of this screenshot from this platform that we have developed in the Barite consortium. So here we not only analyze the wastewater, but we have as well analyzed drinking water, surface water, trying to align as well with the schema for the stationary lab. Next slide, please. I would like to point out the importance of metadata, that the robustness of the metadata structure is crucial and very often overlooked aspect. The metadata are key for facilitating the cross-country global information flow to inform about epidemiological threats. There are some examples of the metadata that we have to be working on, because those were very complex site about description of the site, description about library, and as well we had to have separated metadata for qPCR detection. So there was a lot of work related to that. Next slide, please. So I would like just to point a few conclusions and lessons learned. We believe that actually building upon the existing infrastructure for mobile lab rather than creating an entirely new infrastructure is more sustainable approach and more realistic. And of course, again, as Daria mentioned, the communication and mutual understanding is form the foundation actually for the successful project aimed at capacity building. And yes, and the last one is continuous dialogue on a problem-solving oriented approach among involved partners ensure the achievement of long-term goals and strengthening environmental surveillance. Thank you very much. That's it from me.
Thank you, Adriana, for that a wonderful presentation of the mobile lab setup on the ODIN project. So if you have any question for Adriana, I'll say please keep it, and then we should be able to get to them at the end of this our webinar. If we're unable to get to it, you can also reach out to Adriana directly. If you go on the ODIN website, you can see Adriana's profile and contact information. Then you can reach out to her or the other ODIN PIs, and they'll be more than happy to answer you. So we'll now move on to another presentation. So our next presenter is Dr. Vito Baraka, who is a principal researcher at the National Institute of Medical Research in Tanga, Tanzania. So Vito is going to be talking to us today about our capacity strengthening that is built into the ODIN environmental surveillance project and how that is going. So over to you, Vito.
Hello, can you hear me?
Loud and clear.
Thank you very much. Thanks to the organizers for all the hard work in putting this together, and my colleagues for setting up the stage. So I'm specifically going to speak about the capacity building and capacity strengthening aspect in the project. To start, can you go next, please? This is the outline, so I will highlight a little bit about the landscape in terms of capacity in the 3 African countries, but generally mimicking other sub-Saharan African contexts, and highlight some of the capacity strengthening needs and the approaches within the project to try to address some of the gaps that we've seen in terms of the capacity. And finally, I will give my perspective and consideration in the end. Thank you. So we have to, as you heard in the previous sessions from my colleagues, that Africa is not really starting from zero. We are building on a very well-established polio surveillance program, which is really an asset to us, and it's really a strength. So we had a starting point. And another strength is that within these countries, there's also existing One Health framework and some kind of coordination, although there's still gaps here and there, but there's still some kind of coordination in terms of the One Health approach. However, if you look into the African landscape, you could see that the capacity is not even. So it's, some of the countries have leaped forward, and some of the countries are still lagging behind in the continent. So we saw some of the gaps in sub-Saharan Africa include issues related to governance and sustainability. And I could see there's already some questions from the audience regarding this. So we have been implementing project-based programs which are not really sustainable, and the coordination because water cuts across many sectors is not really very good or optimal, I would say. So there's some issues there, and during the capacity needs assessment, when you are setting up the priorities for the project, we also saw that there's a need to strengthen the genomic and the bioinformatics component in the three countries. We understand that there is already existing capacity in the countries, building on the previous work that has been done in the continent by several partners. However, we saw there's still a gap there. And other thing is the issues about data systems and the interoperability. So we have data sitting in different compartments, and they don't really help us to get the full picture. So we saw there's a need also to address this in terms of the capacity strengthening of the entire system from the sampling all the way to the data interpretation and providing evidence for public health impact. There is also issues about reliability of supply chain systems, and we have been trying to also work around these issues to strengthen the system. So I should also mention that we are building on our previous success in terms of genomics, as we also want to integrate genomics approach in West. So building also on the excellent work that has been done by African CDC in strengthening the genomic in the continent. And also there was another initiative called Project Stella, supported by Global Fund during the SARS-CoV-2. And some of the partners who are contributing to this work were partly beneficiaries of these previous initiatives. And of course, the polio surveillance, as I already mentioned. So the vision, as my previous colleague mentioned, is to have a sustainable wastewater surveillance, which is a program embedded in our surveillance systems across the region. And we've prioritized the waterborne pathogens and AMR as a proof of concept, but with the wastewater, the possibilities are enormous and they could be expanded. So one approach was to really looking into technical expertise and competence. This was really highly prioritized. So we thought about strengthening, systematically strengthening local expertise and workforce in terms of genomics. So all the way starting from the protocol Taria mentioned about the handbook. So we conducted training across all the countries when we were starting up to be able to develop this competence to implement the handbook. issues related to sampling, selection of the sampling, together with the polio surveillance and Project Stella, to be able to have a competent staff who can implement wastewater. However, I should also mention that some of these colleagues were previously also involved in other initiatives such as SARS-CoV-2. And the other approach was to organize tailor-made training for areas that my colleagues have already mentioned about metagenomics and whole genome sequencing, and also qPCR approaches for known targets. So it's really to address the entire workflow from sampling all the way to data generation during the analytical phase, and data sharing and interpretation, and being able also to communicate those data for public health action. So next, please. So now go back, please. So we also thought like we should also emphasize in bioinformatics, because we saw that countries are generating data. However, there's a lack of expertise in bioinformatics, and this was really highly prioritized. And our approach was to select a model that will suit us in terms of longer term and sustainability. So we chose to have the trainer who will be trained on a short course training, and be able to execute analysis or execute pipelines, and then be able to train also other colleagues at this respective institution where we were working. And another approach was to also look into longer term programs, so to really develop skills in terms of advanced bioinformatics skills to colleagues who were selected and were full supported by the project to undertake a full master degree of informatics. And currently we are supporting 4 students across all the 3 African countries to undertake a full master's degree. And they are also involved in the short-term training that we are conducting from the data that we are generating in the project. And these are some of the photos from the previous training that we have conducted. I wouldn't repeat what my colleague has already mentioned about integration of mobile lab, but I can just add that the mobile lab has been very useful in East Africa, and there's a very good coordination and support in the region to scale up mobile lab within the East African community, and also in consideration also in West Africa. We have also organized training looking into integration of some of the approaches, such as metagenomics approach using Oxford Nanopore, and some identification of the targets using the qPCR, portable qPCR that can be integrated in the mobile lab setup to be able to respond to outbreaks, because we understand that sometimes you have an outbreak in areas where you don't have a static lab. And mobile lab has really been very instrumental in responding to disease outbreak, and these capabilities are really, really important in terms of integrating them to help with the outbreak response. Next, please. So my colleagues will speak more in detail, but we have previously organized also training also on water safety plan and sanitation safety plan, because we understand some of the disease risk, especially looking into waterborne pathogens coming maybe from clean water sources. So really to emphasize on proactive risk management to prevent contamination from the source all the way to the end users through enforcing water safety plan. And also looking into the aspect about sanitation safety plan. What we came to realize is that some of the countries already have the water safety plans, but they are not implemented with the utilities at the local level. And we were helping to also build capacity also for the utilities to be able to develop their own water safety plans. And the other thing is the integration of climate resilient water safety plan that will also help to mitigate some of the risk coming from due to the risk of climate change and maybe contamination from other sources such as agricultural runoffs into the the drinking water. And in terms of the sanitation safety plan, so we realized that most of the countries don't really have policies, guidance to support utilities to develop their own safety plans, sanitation safety plans. So currently we are working with the ministries of water and other agencies and water utilities to be able also to develop this policy document that will support sanitation safety plan across the countries. So it's really looking into policy alignment and issues about the water safety and sanitation safety plan. Go ahead, please. So my colleagues already highlighted about the work we were doing to support competencies to develop protocols for mpox. So I won't really repeat that, but we tried to develop and support during the public health emergencies in DRC and other member partner countries to have capacity also to deploy qPCR, which is portable for waste mpox detection, but also going further into genomic aspect to be able to identify what kind of circulating clays is being reported in their own context. And this is relevant because some of the mpox patients will probably not present at the facilities, and therefore, we think there's a potential for using wastewater surveillance in understanding what is going on at the population level. So, next, please. The other thing is we are also trying to contribute into. Can you please go one slide back? We just started also sampling from the airport. There's through the surveillance that we're doing. So we started also sampling from the airport, and this is really contributing into the global health security, the so-called super sites. And the idea is that we have a network of transport hubs that contribute pathogen genomic data so that we know what kind of pathogens are circulating around within the continent, within the region, and also within the globally, also comparing with other countries. And we're looking into synergies and complementarity with other initiatives to support wastewater surveillance at the airport that has been started by the GloverCon and also UNEP, United Nations Environmental Program, to support this global super sites. And we organize this training together with our partners within the GNEPI network in Ethiopia. They are implementing EpiGen, another EDSTP-funded project, and they were able to send colleagues to participate in our capacity building for wastewater sampling in the airport. Next. So this is my last slide. So I would say from what we've learned is that wastewater surveillance is really feasible. However, we need to have adaptable approaches for surveillance. Because maybe looking only into wastewater in Africa will not be giving us a full picture. So we have to go beyond wastewater and looking into non-seaward sites. And my colleagues highlighted really our approach towards targeting also non-seaward sites for surveillance. And we have to capitalize on the One Health approach within the countries and also engaging stakeholders beyond health sector because we most of the time work within our silos, but with the wastewater, for it to be running efficiently, there's other actors and stakeholders beyond health sector that needs to be engaged within the One Health framework. And we have to leverage on existing capacity. The SARS-CoV, I already mentioned, polio surveillance, mobile lab within the EAC coordination to sustain the wastewater surveillance. And we cannot emphasize more about harmonization and the standardization of data to really be able to inform public health and make an impact. So with that, I think I really thank my colleagues and all the institutions and many partners who are contributing to this work, and EDSTP for supporting the study, and also the GNAP network. They also donated some kits to us to support the work that we're doing. Thank you so much.
Thank you very much, Vito, for that elaborate description of the capacity building initiatives within the ODIN consortium. So now, without wasting much time, we'll just go ahead to the next presenter, who is Dr. Shakina Bumbewala, who is a postdoc with VIB UGent, and they've been working on the bioinformatic pipeline and the metagenomic aspect of the ODIN project, and she's just going to go ahead and share their work with us in a bit. Sakina, please go ahead.
Thank you so much, Paul. I would start by giving my thanks to the colleagues at the Global Health Institute for setting up the webinar. Hello everyone, I am Sakina Bombewala and I'm a postdoctoral researcher, and today I will be presenting our bioinformatics work in ODIN consortium, and I'm presenting on the behalf of our team at University of Kent and VIP. So as a part of ODIN consortia, we are a digital connecting layer, and our work is to develop bioinformatics pipelines for data that is generated in this consortium, which is the next generation data, which includes metagenomics, uh, whole genome sequences, RNA data, and viral genome data. So the objectives of our work is to set up bioinformatic processes for sequence data that is collected from our partners in the consortium, and then develop scripts for targeted as well as generalized analysis. And I will talk about it, what is generalized and what is targeted analysis on next slide. Then we facilitate that the data pipeline generate reports which are easy to understand, and then this results are integrated into a dashboard to give a visual representation of our generated data. The important aspect is also adhering to the FAIR guidelines, which is making the data findable, accessible, interpretable, and reusable. Here, as you can see, we act as a digital connecting layer, and the data collected are represented in a form of interactive dashboards. So we have built pipelines for different data that is generated, and these pipelines are built or they are modified using pipeline managers so that they are automated, scalable, and reproducible. Here I'm showing a generalized diagram for analysis of long read data from nanopore sequencer, for example. And here we have different, it's divided into different steps, which starts with demultiplexing the data and quality control, and then it continues to taxonomic analysis, and then um, uh, the user can choose to assemble the data or not assemble the data, and to trigger the functional analysis. And the different functional analysis that we include in a pipeline are generalized functional analysis, as well as antimicrobial resistance genes. Then we have another type of data, which is whole genome sequences, and for that, we also have a pipeline that is built in Pipeline Manager, and uh, the structure for this pipeline is also similar to for the long read, but this is more adapted to Illumina sequences, which are short reads, and here it also involves multiple steps, um, from a quality control, which is major aspect of this pipelines, followed by a taxonomic analysis, followed by functional analysis, and we also have multi-locus sequence typing within this, and also the phylogenetic analysis to get the overall picture of um, genome evolution uh, during our during this project. And then, as part of ODIN Mpox, we have another dedicated pipeline for Mpox, as well as other viral genome sequence analysis. And this pipeline is made so that once it's triggered, um, it can be used for both long reads and short reads with just easy to use commands. Here we also have several steps, which I will not go into detail, but I want to mention that uh, this all scripts and the detailed SOP for using the pipelines are made, and they are made available. I want thank you all for listening to me, and this is our team, and you can reach out to us on our web page, and as well as send us an email if you have any query or you want to uh, know something more. Thank you so much.
Excellent. Thank you very much for your presentation, Shakina. Um, so if you have questions, now hold them close now, because after this next session, you'll be able to ask all your questions. So this is the last bit of the presentation, and it's going to be in two quick succession. So first will be Dr. Mark Taita, who is a researcher with the Clinical Research Unit of Nanoro in Burkina Faso. And then there's also Dr. Fadima, who will follow. They'll be talking about how they were integrating the ODIN project into the water policy, and then and sanitary policy system of the countries, and then cost effectiveness of the project as well. So I'm going to just pass it on to you, Mark. Please go.
Slide, please. Yeah, hello everyone. I'm Mark Christian Taita from the Clinical Research Unit of Nanoro, and I'm leading the ODIN project and ODIN Mpox in Burkina Faso. So today, I will briefly present how integrating wastewater surveillance into water sanitation plan and safety sanitation plan can really strengthen the public health. So I will firstly present for around 6 minutes, and thereafter my colleague Professor Fadima will go with the costing component. Okay, so before going further, please can you go back? So before going further, I would like to give some definition on the concept so that we are at the same level of understanding. That will make things easy. So firstly, water safety plan refer to all things to protect drinking water from the source to the tap, while the safety sanitation plans focus on the sanitation risk from containment to disposal. And water safety plan brings additional layers, providing upstream biological information that routine water screening cannot capture. Next slide, please. Yeah, despite the importance of the water safety plan and also for the sanitation safety plans, there are some limitations. And firstly, those systems are reactive rather than proactive. My colleague Evody already talked on that. And the second aspect is the low sensitivity regarding these techniques. And for the third thing, it's also the weak integration between the water safety sanitation with the public health system. Previous colleague already highlighted on that. So all these limitations justify the need for using wastewater surveillance as an additional high impact data stream to modern water safety plan and safety sanitation plan. Slide, please. One of the strongest value of wastewater that wastewater can add to those systems already implemented in many countries, one of the first added value will be the early detection of the pathogen. And this is one of the main objectives of the ODIN project with the innovative way. And wastewater can detect pathogen days or weeks before the clinical case appear. And it can also give early warning signal for many outbreak. So here the key point, the take-home message will be the early detection change that the wastewater surveillance will bring, turning the water safety management from a reactive to an anticipatory. Next slide, please. The second adding value here will be at the population level, the surveillance. And that population level will include all type of population, like the symptomatic and also the asymptomatic one. So adding wastewater to those two systems will help to capture pathogen signal from the entire community, regardless of the health-seeking behavior. And it also helps to detect the shading from the asymptomatic and also the pre-symptomatic individual, from which clinical surveillance will unfortunately miss. And like as take-home message here, wastewater will provide a more accurate understanding of the true microbial contamination risk at the community level. Next slide, please. The second strength will be the QMRA. QMRA is the quantitative microbial risk assessment. And using that approach will provide quantitative data to the water safety and the safety sanitation plan. And it will also improve the hazard identification, the exposure assessment, and the risk characterization. And of course, at the end, this will help to improve the accuracy and the relevance of the water safety plan and the safety sanitation plan findings. Next slide, please. So after saying that, we can summarize by saying that ODIN was designed precisely to build early warning systems So through detection of priority pathogen, such as Salmonella, Vibrio cholerae, E. coli, before clinical spike, this will enable faster response. And in addition, ODIN will fill critical surveillance gaps by capturing infection in population with limited healthcare access and also being asymptomatics. And a second point will be that it will enhance the water and safety sanitation plan by providing the real-time environmental data to provide hazard identification QMRA and also to help to verify and control the measure put in place to mitigate these issues. Next slide, please. Yeah, ODIN also will help going beyond pathogen detection. So ODIN is also building sustainable laboratories. My colleague Vito, Adriana, and also Tadia already mentioned that. Field and data system that country can be used beyond the project. And this approach will be cost effective. And my colleague, Professor Fadima, will come in a few minutes on that aspect. Next slide, please. Next slide. Yeah. That's like it's like the lesson learned. We've seen that ODIN is using a powerful approach, but as we said, from the theory to the practice, we can have some limitations. So I would like just to go quickly some of the limitations here. And firstly, the laboratory capacity is limited in Africa, limited such in terms of equipment, workflow, QC system, and so they really need to be strengthened. Secondly, we're facing many shortage in molecular biology and environmental microbiology and also bioinformatic expertise. And this is what Dr. Vito highlighted by the capacity training. And third, the country needs more robust computational and data pipeline for genomic analysis. Fourth, the genomic results are not yet fully integrated, as we say, into the decision. We don't have clear SOP linking those water safety plan and safety sanitary plan to the health system. And our last challenge, it's the government's data sharing sustainability challenge, sustainability. And the governance and data sharing remain weak, as you know, with unclear long-term foundings models. Next slide, please. So yeah, I will finish by that slide by saying thanks to all of people attending that webinar. Thanks to our partner and also for the team in Burkina Faso. So I will let the floor to Professor Fadima, who will discuss about the costing of the project. Thank you.
Okay, thank you, Prof. Taita. So my name is Fadimaya Bokoum. I'm health economics based in Burkina Faso, working for the National Center for Research and the Institute for Health Research in Burkina Faso. First of all, I would like to say that, yeah, the wastewater surveillance is really, since COVID-19, it's really interesting, attract interest from the different government and also from different decision maker, because it's a innovative way to survey the pathogen, the human pathogen at risk of outbreak. Also, in the low and middle income countries, they are also interesting to see how they can implement this type of surveillance system. But the implementation means also resource consumptions and also need for money to implement this system. However, there are few costing study in LMIC, and especially in Africa, as you can see, related to these implementations. When we are doing just a quick review, you can find 3 or 4 papers related to these topics, and not specifically on the implementation. So ODIN project is an opportunity to generate knowledge about the cost for such a surveillance system. About the costing approach, we discuss about the different aspects for the costing approach. The first aspect is related to the perspective. Which perspective it will be from the consortium or from the government or health. Also about the objective, it could be different objective for different decision makers. For instance, one decision maker could be interested to know what is a cost saving related to the project, or to understand which area of the program are higher. Also, they can be interested in the application of the system surveillance put the pilot one to see what is the total cost. Or they can also be interested in the sustainability, because they already have implemented, but what could be the sustainability, what could be the cost for the sustainability. And also the other aspect is related to the type of measurement, because even when we put in place a strategy, we need to measure. So there are different outcomes. It could be the primary outcome, or also intermediate outcome, such as for intermediate outcomes, that this reflects the change due to the intervention. For instance, the number of cases treated. For the immediate or process measure, that measures the activities of the interventions. It could be the number of sampling tested or the number of pathogen detected. And the different type of study is more related to the cost analysis, or the cost effectiveness, or cost benefits. Next. The objective for the ODIN, it will be to investigate the cost of implementation, and we have 2 objectives: to estimate this cost of implementation in Burkina Faso, and the second one is to document this process to allow other countries to learn from this experience. And for the method, I will not come back, but we will just have the government perspective. The expected outcome will be the financial and economic cost and the cost driver. Next. So thank you for your attention. And I would like also to acknowledge the consortium of ODIN. Thank you.
Thank you very much, Dr. Fadima, and thank you, Dr. Tahita, as well, for your presentation. So I think at this point, we've heard a lot from the ODIN team. We will now try to address some of the questions that people have posed to the speakers. So I don't have to go all the way back, but I know there is particularly 2 questions here, which I can probably put together into one for Adriana regarding mobile lab setup. So did you mean that stationing the MSL within existing infrastructure involves placing it in a nearby health center, dispensary, or a similar facility? And a similar question to that is, for the mobile labs, are separate specialized personnel trained for it, or it's the sample collectors that are trained to operate it? So Dr. Krolika, do you want to answer that?
Yes, it's actually a very good question, because on the picture you could see that this was not really done somewhere in the village. It was done close in the city, and the reason why we had to deploy the mobile app in Dar es Salaam, and by actually the National Public Health Lab, This was because of our country limitation to travel inside the Tanzania. So, and as well, we thought that since this is a demonstration lab, it really didn't make a big difference, since already this kind of the additional goal was the training. So for many people, even it was much easier to join the training in Dar es Salaam instead of traveling inside the country. So that's why. And the second question, could you just read again, because maybe I didn't fully understood the second question.
Okay, so the second question is asking if you have specialized personnel that are trained to operate the mobile labs, or you use the sample collectors to operate it.
No, we don't have really specialized people that are working in this mobile lab, not now, but for the training was done to kind of provide this, give this training for our partners to be able to kind of mimic or repeat the kind of our activity in their home country. That was the goal. Yes. I hope I answered the question.
Excellent, excellent. Well, I think you did. So I I think you did. One of the things that I really find interesting, and I love the most about the ODIN project is because of the sustainability that is really built into it. I remember when I joined the team, there was we were having this issue with supply chain for and then I remember at that meeting I said, oh, we've been working with a lot of African partners, and what they usually do is they come to Oxford, they will buy it and and smuggle it in their bag or ship it or something. And I remember Rolf said at that meeting, I said, okay, well, but we are trying to do a more systemic approach to solving the problem. And that's what we've been trying to engage with, we've been trying to other partners within the Bill and Melinda Gates Foundation, other genetic team members, to try and see how that our problem could be solved. And I think that's really impressive. Okay, so we've come to the end of the webinar, actually officially. If any of the panelists have any comments or any question or any points to make before we close the webinar. Do you have anything to share, Rolf, Mark, Taria? Sakina, excellent. So if there's nothing, so we first want to especially thank the European Commission and the EDCTP3 for funding the ODIN and the ODIN MPOX project. And this has been a wonderful approach to environmental surveillance and strengthening capacity for genomics and bioinformatics and in Africa. Now, the recording of this webinar is going to be placed on the website, the ODIN website, in the coming days. So please be on the lookout for that. We also have the post-webinar survey here. So if you can scan the QR code, or the link will also be in the chat. So please help us fill the survey and tell us how this webinar today has been. And then please check the ODIN website for any information. I think all the profile of the PIs and people working on ODIN project are there, so you can get in touch with them. I want to be sure that I'm not missing anything before we close the webinar officially. I want to thank you very much for your time, and I want to wish you all a wonderful rest of the day.